Hello everyone, and welcome to Mr. Simplify's tutorials. In this tutorial, we are looking at what reactive attachment disorder is, what causes it, the psychological analysis of attachments, and we are going to look at what treatment options are recommended. What is reactive attachment disorder? Reactive attachment disorder, RAD, in children is a condition where a child doesn't form healthy emotional bonds with their caretakers or parental figures because of the inability of the child to form attachments. RAD is classified by the American Psychiatric Association under stress and trauma-related disorders. Studies concluded that children diagnosed with RAD could have difficulties trusting people and forming relationships as adults as well. In this tutorial, we find out what could cause RAD, who it could affect and how it's caused and ways to potentially treat it. We're also going to look into if adults can suffer RAD. And as always, references are provided in the description for further reading. What are the symptoms of RAD? There can be a number of symptoms indicating RAD in children. Some of them are as follows. Avoiding eye contact and physical touch with people almost entirely. Not displaying positive emotions like love and comfort when interacting with others. Being unpredictable, expressing fear and throwing tantrums randomly and frequently, followed by bouts of sadness. Breaking basic rules constantly and finding things to exert control on. This could include mutilating toys and breaking objects in the house deliberately. One of the symptoms of RAD tends to be indiscriminate friendliness, which basically means that the child could behave with strangers the same way it would behave with the primary caregivers and not actually be wary of strangers, which would actually be very dangerous. A study by Pierce in 2009 also suggests that children with RAD consider themselves as worthless and unlovable. This could also be one of the factors making them not connect with anyone at all. And what could be causing RAD? There could never be an exact cause for psychological disorders. And when it comes to RAD, it could affect 1 to 2% of children. Children are more likely to develop RAD if the following factors are in play. Experiencing traumatic losses earlier in life. Experiencing abuse or neglect from caregivers, experiencing food insecurity and anxiety because of not being fed when hungry, feeling unsafe in the environment despite caregivers being present, lack of hygiene, which can result from spending hours wearing soiled diapers, having multiple caregivers with the child knowing who to fully trust, experiencing inconsistent caregiving. This happens when the child's needs are met only some of the time and neglected on other occasions. Experiencing separation from primary caregivers after forming emotional bonds with them. Spending time in institutions like orphanages and foster homes and actually not receiving consistent care from the same people. Substance abuse and poor mental health of the caregivers could also be factors according to research. Now let's look into psychological reasons for why the above factors could be causing RAD. Attachments. Now we've looked at attachment theory and all of its contributors in detail in another tutorial in this channel. Please do check that out. The founder of attachment theory, John Bowlby, theorized that attachment is crucial for a child to develop social skills. If a child experiences abuse, neglect, or a combination of the circumstances we just outlined, it might not develop a secure attachment with any caregiver. And when a child develops an insecure attachment of any type, it will perceive the world as being unsafe and view himself or herself as being unloved or unimportant. And since critical development takes place in formative years, a lack of strong secured attachments can go a long way in encouraging attachment disorders in children. One of the symptoms of RAD is indiscriminate friendliness that we just spoke, or not being wary of strangers. This is generally because of a child not developing stranger anxiety which normally develops at around the age of 6 months in conditions of secure attachment. More recent research has concluded that RAD could actually arise from a combination of genetic and social environment factors. And some researchers have also demonstrated that RAD can also coexist with secure attachment. So it's once again a combination of nature and nurture, with nurture in the formative years playing a major role. Now let's look at if RAD can happen only to children, and also if it can happen to any child. Childhood abuse and neglect are clearly the major contributing factors leading to RAD. It can therefore unfortunately happen to any child, with certain children having a higher probability than others because of genetic factors. Several studies in the US have concluded that children in foster care are 10 times more likely to have mental health challenges than children not in foster care. This is again due to the formation of insecure attachments. This is again a link with childhood maltreatment, as a 2018 study in the US demonstrates that over 7.5 million children were subjected to maltreatment, and many of them were then transferred to foster homes. But this doesn't mean that all children in foster homes will have mental health disorders, including RAD. A 2013 study conducted in the UK assessed children considered to be a part of deprived families in the UK. And the study concluded that RAD was considerably more prevalent in deprived households when compared to the national average. So you can see that it's not a problem that's restricted to foster homes. And another 2010 study in the UK demonstrated that adults with intellectual disabilities can also demonstrate certain RAD symptoms. So it's also not just restricted to children in its entirety. So what interventions and treatment methods exist for RAD? But before we get into treatment options, I also want to recommend that you check out our tutorial on trauma, PTSD and psychosis to understand more about mental health disorders and getting help for it. Treatment for RAD usually includes therapy for both children and their caregivers where possible. Attachment therapy or family-based attachment therapy methods can be utilized to strengthen the bond between a child and the caregivers. The focus with the child would be to change its perspective of being unloved and undeserving of love. From the caregiver's perspective, therapy should be directed at teaching them to be more proactively affectionate and attentive towards the child. Holding therapy is a specific form of therapy advised for certain RAD patients. Now, Bowlby suggested that a child's aversion to touch can be reduced by gradual exposure to practices like tickling or poking while being held and protected by the caregiver. So this is also another therapy procedure or method that is often followed. Social skills intervention can be another therapy used to help children to learn to interact appropriately with other similar age children in social settings. Caregivers are usually involved to ensure that the learnings are continued outside of therapy. An important aspect of therapy should be to ensure that the intervention is tailored to the specific needs of the child and to address specific developmental delays in the child. Okay, so that was all that we were going to cover in this tutorial on reactive attachment disorders. I thank you very much for your attendance as always. And as always, if you like the content in this channel, please like, share and subscribe, and take very good care of your own self. Thank you very much.